treat each other's views with respect. And I respect the views of everyone here, including everyone in the audience. And that respect, in turn, means listening and not interrupting when others are speaking. I sincerely hope that everyone here today, including our guests, especially guests in the audience, will afford these proceedings with that level of respect. The novelist Edith Wharton said, "The only way not to think about money is to have a great deal of it." Today we host the third of our 3 roundtable discussions on health care reform. This one thinks about money. With any luck, we'll have a great deal of it. This roundtable discussion will preview many of the revenue and savings options that the committee will consider at a walkthrough session next week, heading into our markup next month. The committee has spent a good deal of time laying the groundwork for comprehensive health care reform. We've discussed ways to reform the health care delivery system. We have talked about ways to provide health coverage to all Americans. Now it's time to think about money. It's time to talk about how to finance health care reform. I am committed to comprehensive reform of our health care system, but I also recognize that we need to pay for it. The proposals that we have discussed in our previous roundtables and the walkthrough will not come easily. The reforms we are planning will not be cheap. But Americans already spend $4.5 million on health care every minute of the day. That's $2.5 trillion a year. Without reform over the next 10 years, America will spend more than $33 trillion on health care. The federal government alone spends nearly $700 billion a year on Medicare and Medicaid. And the federal government forgoes almost $300 billion a year in federal tax revenue and health care tax expenditures. The costs of health care are high for families, for businesses, for the federal government and states alike. To make the system more affordable and provide coverage for all, we need to look at where we spend money on health care today. And when it comes to the government, we need to look at both spending and tax expenditures. The first place that we should look for savings is within health care itself. We should reform the health care delivery system to bring higher quality and greater efficiency to all Americans. We discussed a range of reforms during the walkthrough on delivery system reform, and we will discuss additional savings options today. We should also look at the current tax treatment of health care. I know that there is some controversy about doing so. Some do not want to modify the current unlimited exclusion for employer-provided health care. And I agree that we are not going to eliminate that exclusion. But the current tax exclusion is not perfect. It is regressive. It often leads people to buy more health coverage than they need. We should look at ways to modify the current tax exclusion so that it provides the right incentives. And we should look to ways to make it fairer and more equitable for everyone. We also need to look at other tax benefits for health care. Among these are tax-preferred health savings accounts and the itemized deduction for health expenses. We should try to make sure that those benefits are structured fairly and efficiently. And because of the cost of comprehensive health care reform, we'll need to look at other options. Among those is the President's proposal to limit itemized deductions. All of these ideas deserve close and careful scrutiny and discussion. Finding money that we can all agree on will not be easy, but few worthwhile things are. Achieving comprehensive health care reform is important enough that we must find a way to succeed. This roundtable will begin the discussion of how we can responsibly finance health care reform. At next week's walkthrough, we'll look at the menu of options for finance reform. We need to keep all the options on the table, and everyone has to give and take to make this work. And I hope that my colleagues here will keep an open mind as we start this discussion. Together, we can find the money that we will need to finance comprehensive health care reform. It will not be easy. This roundtable is an important part of those discussions. Each of our participants today brings an important voice to the discussion. They are experts, stakeholders, or both. And once again, forgive me for not taking the time to introduce every participant. We have, however, distributed a biographical sketch and a brief statement for each participant. And as we did before, we gave each participant and senator some questions that will help start a dialogue. And beyond that, I look forward to a very fruitful discussion. So let's get started. Let's see if we can advance the effort of comprehensive health care reform. Senator Grassley.
Have a legal duty to advocate to change circumstances that are against the interests or wishes of our patients.
They will be in order.
Today is
Comments from the audience are inappropriate and out of order. Any further disruption will cause the committee to recess until the police can restore order.
Florence Nightingale said, sir.
Committee will be in order. Committee will stand in recess until the police can restore order.
Florence Nightingale said, were there none that ever hoped for better, there would never be any better. Until there's a single-payer health care system in this country, there will never be safety for patients that need access to medically necessary care. Florence Nightingale, patients need access to medically necessary health care.
Mr. Chairman.
The people at this table have failed Americans for 30 years.
Stand in recess until the police can restore order.
Single-payer at this table. Health care is a human right. We want guaranteed health care. No more blue crosses, double crosses. We want guaranteed health care. No more Aetna. Thank you. No more Aetna or Cigna bosses. We want guaranteed health care. We want to see our doctors when we need and get our pills that are guaranteed. We're tired of private insurance free. We want guaranteed health care. In California, SBA 10 is guaranteed health care. And HR 676 is guaranteed health care.
Let me just speak a few minutes. Sorry, in order. Being a recess until order can be restored.
Want a single-payer system. Why do you insist on spending more money when the single-payer would give it to us at the price we're spending now? 60%. Why not 60% of the people in front of you representing single-payer? 60% of the people want single-payer. This is a sham. All you've got is special interest groups up there.
Stand in recess until the police can restore order. I'll ask for the police, please come more expeditiously.
Why aren't single-payer advocates at the table? Healthcare should be for patients, not for profits.
I am Dr. Stephen Fedichel, and it is a sense of outrage that brings me to the Senate chamber. You have been entrusted with doing the people's work, and yet you
Committee will stand in recess until the police can restore order.
The insurance companies, the hospitals for profit.
And I'll say to everybody else out in the audience who may be similarly inclined, believe me, we hear you. We deeply respect the views of everyone here. We've got an extremely open process, and I just urge everyone to respect the views of others by not interrupting those who are speaking. There'll be plenty of time to meet with everybody. This is a long, involved process, and so those of you in the audience who are not panelists and wish to be heard, I urge you just to contact my office, and we'll figure out a way to talk to you. I'll figure out a way to listen to you. I'll be there personally to listen to you. So I urge you to take that option rather than to interrupt and be rude to our panelists here who've come a long distance and spent a long time trying to make very thoughtful presentations to the committee. But I will meet with anybody who wants to meet with me. Okay. Senator Grassley.